Let's talk about exams, medical board exams. With Dr. Kwafu, hey. Everybody got around it. Let's talk about exams.
Hello viewers, welcome back to the Medical Board Exam Experience with Dr. Kwafu. Mrcog exams, which stands for Member Royal College of Obstetricians and Gynecologists, is an internationally recognized gold standard qualification exams to become a specialist in obstetrics and gynecology. This exam is in 3 parts. Dr. Janani, who is an international medical graduate of India, has successfully passed the part 1 of these exams and has joined us today to share with us her experience on how he studied and prepared for these exams. Let us join Dr. Janani in our discussion. Viewers, on this channel, I interview doctors who have successfully passed or failed any medical board exams to share their exams preparation experience with us and with all those preparing to write theirs. If you are watching me and you have experience in any medical board exams and would like to share with us, kindly contact me on my Facebook page, Instagram, or leave a comment at the comment section of this video and I'll keep in touch. Please do not forget to subscribe to this channel and recommend this channel to any medical student or medical doctor who is preparing to write the board exams of any country. Thank you.
All right, so I want to know, what is the Mrcog exams?
It's a membership exam of the Royal College of Obstetricians and Gynecologists. So that has 3 parts. And I have taken part 1 I took in 2018 actually. And now I'm currently preparing for my part 2. I was supposed to give in September, but then my slot got postponed to January. So I'm going to give it in January.
Okay, is it something that is only for Indians or for everyone, the Mrcog?
Everyone to write. Only for part 3 of Mrcog, you might probably need some experience in obstetrics and gynecology. I think it was 4 years, I guess. So that has to be, there is something called as assessment of training, AOT, which you need to do before going for your part 3. Previously, it was for part 2. So I had applied for my AOT for part 2 as well and got that approved. So you need at least 4 years of experience exclusively in the Department of Obstetrics and Gynecology. It can be anything. It can be a post-graduation or you can be working in obstetrics and gynecology. So you need to have at least 4 years of experience to give the exam.
Is it a specialist exams?
Yeah, definitely, yeah.
Okay, so if you pass, then that means you are a specialist in obs and gynae?
Yes, you're a special, yeah. Yes.
Is it recognized by the whole world, or is just that particular college?
No, it is recognized in Australia, New Zealand, the UAE countries, and Singapore, Malaysia. So it is recognized by a lot of other countries as well.
Okay. So can you take it anywhere, or you have to be in specific countries to be able to take it?
No, you can write from anywhere actually. You don't need to be from any specific country.
Okay.
Yeah.
Can you write it right after graduation as a young graduate? Can you take part?
There are 3 parts actually.
Okay.
So the part 1 is what I wrote in 2018, which is almost like a basic assessment of your concepts like genetics, embryology, endocrinology, pharmacology, all the basics, pathology, micro. So all these basic subjects will be covered. And the part 2, what I'm preparing for is on the guidelines and all the recommendations by the guidelines. So it's more like a clinical examination.
Okay, and the part 3?
The part 3 is like an OSCE station. There are various stations. So you will be tested practically on the various stations. It is an OSCE examination.
Okay. So if you do not take the Mrcog exams, you cannot use the PLAB to be a specialist in gynecology?
No, it only allows, PLAB allows me only to work in the UK. So probably if I finish after my PLAB, I can join as a junior doctor. Or because I finished my part 1 MRCOG, probably from a lower level of specialty training, like an ST1 or an ST2. But if I finish my MRCOG, I can probably join as a registrar. So that's the difference.
Oh, okay. So if you have MRCOG, you are higher than a normal doctor who is writing the PLAB.
Yes, yeah, definitely. Yeah.
Okay, okay. So how did you study for the part 1? Did you use the same material like the PLAB
No,
material?
actually, I had some books for my part 1.
Okay,
So I had Oxford revision notes for MRCOG. That was one book which I followed. And then there was another book called Philip and Bennett, which I had to use. So I used these two books. So that's about it. Yeah, I didn't go for any other course or anything else for my part 1.
okay. So how long did it take you to prepare for the part 1?
Part 1, I had prepared like on and off in between, like for some time, but I gave my intense preparation for a month. Because I was working and I had a baby at the same time, so it was little difficult. So I gave 1 month of preparation along with working actually. So I would do in between my duties whenever I was free in the hospital and in between. Yeah.
So how many hours will you say you studied in a day?
That was a very I could not organize myself how I did for PLAB right now, because I could be at home and I could prepare properly for PLAB. For my MRCOG, it was not like I used to study whenever I get time.
Okay,
So probably 4 hours or something per day, I guess, or in the night, sometime in the night, or in this hospital. Whenever I get time, I used to open my book and study.
okay, okay. So what is the cost of registering for these exams? How much does it cost?
It's around, I think, 300 pounds that time, close to 300, a little less than that. Yeah. But apart from that, yeah, nothing else, because I didn't go for any course or anything. So it was just the registration fee.
Okay. So in terms of difficulties next level, is it the same as the PLAB 1 exams? Is it difficult like the
No,
PLAB 1
it's
exams?
not same as PLAB 1 exam. Definitely, it's not the same. It is a little deeper into obstetrics and gynecology, but the basic concepts like embryology and genetics, you get a lot of questions from genetics, embryology, pathology, and a lot of images, ultrasound images, and specimen images. A lot of images were there in my examination, and it's a very long examination. So it's 6 hours actually,
Okay.
and so you need to be a little prepared for a long exam. It's not like PLAB. You cannot finish it in 3 hours. So it's like a part A and a part B exam. 2 papers will be there, and you get 1 hour break in between. So you need to be little prepared for a longer exam.
Okay. Okay. So will you recommend a young medical graduate to start preparing for MRCOG exams?
Yes, definitely. If they are interested in obstetrics and gynecology, and if they want to come to the UK, or even if they don't want to come to the UK, this exam gives you a lot of knowledge about how you deal with the patients, and especially now that I'm preparing for part 1, you read all the guidance and all the recommendations, so you're very clear in your concepts. Your concepts gets extremely clear when you're preparing for this exam. So that
Okay.
is, and how to deal with the patients, how to talk with the patients, everything gets reinforced in this. So it is definitely a good degree to go about if for anybody who is interested in obstetrics and gynecology.
Okay. So for anyone preparing for the MRCOG exams, per your experience, what advice will you give to that person?
It is a long journey. You need to be prepared for that. It is not something which you can get done in a year. There are 3 parts, and part 2 is where you need very intense preparation, a lot of hard work, And as like for me, my slot got little postponed to January because I was already doing my revisions and I was going to give in September actually. So
Okay.
it got postponed to January. So that was one more. Okay. I mean, that was the little disappointing thing. But anyways, so you need a lot of preparation. Lot of preparation. It's not an easy exam. You need deep, in-depth knowledge about every concept. But it is definitely worth it because every time you read a guidance or a recommendation, you see new things. And whenever you see a patient or you read about anything after you prepare for this exam, you see it in a very different way. Your approach is very different.
Okay.
Your knowledge
So,
is definitely much more. You will have in-depth knowledge once you prepare for this exam. Yeah.
okay. Okay. So when do you plan to take the part 2?
I'm giving in January.
Or next year, January?
Yeah. I was supposed to give in September, but I couldn't get a slot, so I'm giving it in January.
Okay. You can take it in UK, right?
Yeah, I am.
But the first one, you took the first one in India.
Okay. Yeah,
So
I did. I gave my first one in India. Yeah.
I don't hear much about the Mrcog exams. Is it
Yeah, because it's little difficult, I guess.
okay?
It's
So
not an easy exam to pass, definitely. You
mm,
need a lot of preparation, and I guess it's little difficult. Maybe that is why people are. But as far as I know, now a lot of people are taking up Mrcog.
okay, is that the only exams you can take to become a specialist in obs and gynae?
No, you can go through the PLAB route as well. Just after PLAB, you can go for you can apply for obstetrics and gynecology as your specialty. From ST1, you can start. You can definitely do that. But if you have finished your MRCOG, then you can probably start at a registrar level. It's just the number of years that is going to be different. But
Oh, okay,
anyways, you need to do your MRCOG. Even if you go through PLAB and you are starting as a trainee in obstetrics and gynecology, you need to finish your part 1, part 2, and part 3 by the end of your course.
okay, all right. Okay, hopefully when you finish the flap 2 and we will meet again to share your experience about the flap 2.
Of course. Yes, of course. Yeah, thank you.
Yes. So Doctor, I'll thank you very much for your time, and
Thank you.
I really appreciate it. Thank you
Thank you.
very much.
Yeah, thank you
Yes,
for inviting me. Yeah, thank you.
you are.
Let's talk about exams.